Hello, I'm Dr. Daniel Cartledge. I practice interventional pain management in Delray Beach, Florida at the National Pain Institute, and today we're talking about low back pain. For some, low back pain can occur after an accident or injury, perhaps after a car accident, or for some of us it can happen from general overuse, wear and tear on our backs, or even just from the normal aging process. There are many different causes for low back pain, and it's my job to figure out what's the pain generator, what's causing the low back pain, and what I need to do to treat it for my patients and make them more comfortable. You see, here's our lumbar spine, and some low back pain can be attributed to what we call mechanical causes or inflammation of the joints of the spine. These are the range of motion joints of the spine. These are the lumbar facet joints over here, and these are the sacroiliac joints. All of these joints can present as pain generators. As we age, arthritis can develop in these joints. And with lumbar facet arthritis, we can have either localized low back pain that's typically non-radiating, or sometimes it can actually present as a band-like, almost like a belt of pain in the low back. The sacroiliac joints can also develop arthritis, either from injury or from the aging process. Sacroiliitis can present as low back pain, buttock pain, and in some cases that pain can even travel to the hip area, to the groin area, or even down the thighs to the knees. Spinal stenosis, or pressure on the actual spinal cord itself. You can see a little bit of the spinal cord here, this yellow rubber that we see. Spinal stenosis can present as localized low back pain, or in some cases the pain can travel down the legs. This can make it difficult to walk, difficult to get out of bed. Another cause of low back pain can be discogenic or disc-related problems. Our discs can sometimes can flatten over time. They lose some of the fluid that keeps them full as we age. Sometimes an injury can cause an acute disc bulge or a disc herniation. When people have disc bulges or herniations, when the discs push on the nerve roots, these little yellow tabs that come off of the spinal cord, that pain can sometimes travel down the legs, and we call that sciatica. So what do we do for this? Treatment for different causes of low back pain can be medication, physical therapy, or certain interventional procedures that we do. Getting back to the arthritic pain that we talked about, the arthritis of the facet joints or sacroiliac joints, we can inject anti-inflammatory medications, including anti-inflammatory steroids, into these joints. These injections would be done in a procedure room or a surgical center, and they would be image guided. In other words, these injections would be done under a live fluoroscope or X-ray. So a thin spinal needle can be used to inject a mixture of lidocaine or numbing medicine and anti-inflammatory medication into these joints, either the sacroiliac joints or the facet joints. For sciatica or for spinal stenosis, again, that narrowing or pressure on the spinal cord itself, an epidural injection can be performed. And with epidural injections, a steroid anti-inflammatory can be injected into the epidural space that surrounds the discs, the spinal cord, and the nerve roots to help relieve pressure and inflammation. Or we can also do what's called a transforaminal epidural, which is done for a specific nerve root that's being compressed, either from a bulging disc or from inflammation. And these treatments, again, would be done under live X-ray and can be very helpful in controlling the types of pain that can be caused from spinal stenosis or from herniated disc causing sciatica, causing pressure on nerve roots.